You have a 30-year-old male who is telling you that he has lost 6 kgs of weight in last 2 months, which was obviously unintentional. Now you have to take focused history and perform focused examination to find out the cause of his weight loss and manage his concerns. So introduce yourself, confirm patient's identity, tell the patient about the agenda of today's meeting, and then start asking the focused history. His chief complaint was weight loss, so ask him about when did weight loss started exactly. I mean the onset, then course, then progression, and next aggravating and relieving factors. Then ask some focused questions about weight loss. Is there any history of weight loss despite normal or increased appetite? Is there any problem with bowel motion? Any history of diarrhea, GI upset? If you suspect from the patient's appearance that he may have hyperthyroidism or Graves' disease, then go directly into asking about specific questions related to hyperthyroidism. Ask him about weather preference. Do you prefer hot weather or cold weather? Do you sweat excessively? Have you noticed any abnormal heartbeat or any racing or pacing of heart? Because hyperthyroidism is associated with atrial fibrillation and tachycardia. If the patient was female, then you should ask about menstrual history, history of oral contraceptive pill, history of pregnancy. Then some other specific questions about hyperthyroidism can be: do you suffer from anxiety or irritability? Do you have any neck swelling? Do you have any eye problem? Do you think your eyes are excessively red? Do you feel any grittiness on your eyes, any excessive eye watering? Do you have any eye pain? And do you have any problem with your vision? Then ask about tremors. Do you have any shakiness of your hands or feet? After that, you can take his medication history and history of other comorbid factors like hypertension, heart disease like heart failure, any kidney problems, any asthma, any diabetes, etc. Next, you should proceed to perform some focused examination. You need to perform general inspection of the patient very carefully. You need to specifically look for any signs of anxious expression, any signs of proptosis, any fidgety movement, or any peripheral tremor, and if there is any obvious goiter or neck swelling. Then examine patient's hand for thyroid acropathy. If the patient has excessive sweating, then his hands would be moist, and you can also check the hands for fine tremor and proximal myopathy. Examine the eye for lid lag and lid retraction. Examine for the features of Graves' ophthalmopathy. These are red eyes, excessive lacrimation, periorbital edema, proptosis, conjunctival edema, and ophthalmoplegia. Ask the patient if there is any problem with eye movement. Check the patient's neck for any thyroidectomy scar, any goiter, and if there is any palpable nodule or any retrosternal mass. Auscultate patient's neck for the presence of thyroid bruit. Next, examine patient's legs to identify any pretibial myxedema if present. Then finally ask the patient about any skin rash or skin disease, because vitiligo is associated with hyperthyroidism. Then you need to take his brief social history. You should already know what to ask to obtain a social history from the previous podcasts. Lastly, explain the patient about his condition. You can tell him that from today's discussion, it appears to me that you have a hyperactive thyroid gland. Thyroid is a small gland that is located in front of our neck. and that's why you are having all these symptoms. Mention about the symptoms. So you also should tell him about the further management plan. You should tell him that we would perform some tests like thyroid imaging and some blood tests, and also attach you with our multidisciplinary team to further treat your condition. Fortunately, this condition is treatable, so we hope that we would have good outcome. The examiners may ask you what are the causes of hyperthyroidism. The causes are Graves' disease, toxic multinodular goiter, toxic thyroid adenoma, D. quervans thyroiditis, postpartum thyroiditis, and some drugs like amiodarone and lithium. Examiners can also ask you what are the causes of a goiter. The causes of a diffuse goiter are simple diffuse goiter, Graves' disease, Hashimoto's thyroiditis, D. quervans thyroiditis, and thyroid lymphoma. The causes of a nodular goiter can be toxic adenoma, thyroid carcinoma, and multinodular goiter. What thyroid disorders are specific to Graves' disease? These are Graves' ophthalmopathy, thyroid acropathy, and pretibial myxedema. What are the common hyperthyroid emergencies? These are thyrotoxic storm, exophthalmos causing fixed gaze diplopia or decreased acuity or loss of color vision, and high output cardiac failure.